Hi, Cindy here, Gen H Wellness. Let's go over what to expect on your first acupuncture treatment. It is very exciting, but I know it could be nerve-wracking if you've never had acupuncture before. And that's okay. It's normal to be scared when you're trying something new, when you're trying something that is not very common nowadays. Hopefully, it will be in the future. But I don't want you to be nervous. I'm going to take great care of you. Whatever your concerns are, we will address them before we begin treatment. If you're coming for something simple, it should take 10 to 15 minutes of us chatting, and then we'll get you on the table and start the treatment. If you're coming for a complex issue, we're going to spend 30 to 45 minutes talking, just having a conversation, you and I, going over your intake. And I'll also be answering any questions, any concerns that you may have. Once you come in, we will sit down, have this chat. Afterwards, we will begin treatment. I will give you my best recommendation in terms of what I think the best course of action would be so you could start feeling better. We will go over timing and frequency of treatments in order to maximize the effects of acupuncture and Chinese medicine. There is also a video I made explaining how acupuncture works, and I want you to go ahead and watch that before our first visit so you can get acquainted to the expectations of how acupuncture is going to work. After we do a proper assessment and discuss the best course of action, I will go on to do further diagnostics, and this includes looking at your tongue, feeling your pulse, palpating your abdomen, which is called Hara diagnosis. It's a form of Japanese acupuncture. And based on my findings, then I would come up with the best treatment for you. I may also do some range of motion, some orthopedic testing, depends on what you're coming in for. And then we will get you on the table. And once you're on the table, you're either going to be facing up or facing down. If you have any issues or you have anxiety or for some reason you're not comfortable facing down, we are able to do the treatments on the side if I need to get access to your back, or we could just do a face up treatment. The beauty of this medicine is that it's individualized. I'm able to work with you on what you need so that you get the best experience and the best results. Or you might be laying up. So if you're unable to lay down, maybe you have a cough, you can't lay down because you start coughing up, or maybe you're pregnant and we don't want to do a sideways treatment, we can have you laying up. We'll get you nice and cozy. So while you are on the treatment table, I'll start putting some needles in. So I get asked if acupuncture hurts. And to be honest, it is a needle and I am producing a micro trauma to your body. So you might feel a little pinch, you might not feel much at all. And it's going to really depend on how inflamed you are, how chronic or acute the areas that I am needling. If I am close to any area of inflammation and pain, it might be tender, but there's not going to be any excruciating pain. You might feel pressure around the needles, you might feel pulsations, energy, but you should not feel pain. If you do feel a burning sensation or something that is not going away after the insertion of needle, then you let me know and I will fix that for you. I don't want you to be uncomfortable in any form. So there's going to be a lot of communication between you and I. I need you to communicate with me if you're comfortable, what you feel, and I will be communicating with you what I am doing. I also discussed this on the how to prepare for acupuncture video. So if you have comfy clothes, perfect, or you might need to disrobe, and I'll give you some towels to cover up with. I will mainly need access to your hands, arms, your legs, face, ears, and your belly. So after that, making sure you're comfortable, you're set on the table, making sure you don't need to use the bathroom. Please use the restroom before our treatment. We do have a restroom in the facility. I will get you on the table and I will wield my magic tiny wands, acupuncture needles. And after I insert all the needles, make sure you're doing good. You'll have some time for yourself to rest for about 20 minutes or more, depending on our timing and depending on how much you need. Every person is different. If you are deficient and you don't have enough energy in your body, I don't want to use all that energy on an acupuncture treatment. I want your body to get the signaling that it needs from the treatment so then it could go ahead and heal. I don't want to use all your resources. Depending on what we are treating, it's going to range between 20 to 45 minutes of you laying down on the table after I insert the needles. Treatment starts on the first insertion of the first needle. And while you're resting, I'll come in and check on you periodically. So that might be every 5 minutes, every 10 minutes. 99% of the time, you're in there. You are just going to zone out, either go into a nice meditative state or you're going to fall asleep. And if you fall asleep, that's great. You need it. Take the rest. Take this time for yourself that not many of us have. Go into your limbo state. I call it a limbo state because you're not here or there. You're not asleep, but you're not awake. It's a good place to be. So you should feel relaxed during this time. You might feel some energy moving. You might feel some of the needles activating, like they will pulsate or maybe a little throbbing on and off. You might not feel anything at all. Everyone's different. Everyone has different experiences. Some people even start to see colors. It can get really fun. And there's also the chance that you might not go into a meditative state, that you might not fall asleep, that you might not see colors, and that's okay. You don't have to experience all these things, especially on your first treatment. Things might be a little different because you might be a little nervous, your nervous system might be a little on overdrive, and that's okay. That is totally fine. The needles are still doing their job, and you might not feel it during the treatment, but you might feel it afterwards. And when I come in, it might even feel like you've just been on the table for 5 minutes. Trust me, I give you the time you needed. It just feels short, it goes by quick. So after treatment, I will come in and take the needles out, and you might not feel it while you're laying down, but once you get up, you'll probably feel lighter and relaxed and better than you did when you came in terms of relaxation. In terms of pain, you should feel relief as well. After our treatment, acupuncture is going to keep working on you for the next couple days. And the next treatment, I won't bother you. I won't be checking on you. I will just let you rest the whole time. That way I'm not interrupting your sleep or your meditation or your rest. And if you need to take some time after the treatment and you need to sit down in the waiting room, maybe sip on a cup of tea, please do so. Sometimes you are so relaxed or you're waking up and you might not know where you are. So take the time to come back to ground yourself and get your head right before you go out into the world. For the next coming days after treatment, you might expect to keep this feeling of relaxation. You might feel the things that would trigger you normally don't trigger you, or that you are able to handle stress better, that your sleep is better. It will be very subtle. So just pay attention to those small changes that are happening. We are regulating your nervous system and bringing things into balance. The way you handle things that will normally upset you or normally cause some kind of reaction. Now you're like, it's just going to roll off my shoulder and everything's okay. I hope this covered what to expect on your first acupuncture treatment. If you have any questions, please reach out. Take care. Speak soon.